channel. My name is Dr. Isabella and I'm your personal cosmetic doctor and your friend. And today I'm here to talk with you about the 7 important things you need to know about lip fillers. Yes, and let's get right on. Let's start with number 1. Fillers, lip fillers. What are lip fillers exactly and what do we use when we do lip augmentation? So this is a very important one because a lot of you guys still do not know exactly the difference between Botox and fillers. Sometimes you guys come and say, I want Botox in my lips, and I really hope you don't want Botox in your lips because if you want, you will not be able to talk or eat or whatever. Because Botox is, as we have talked in our previous video, Botox is a substance which makes your muscles still. So your muscles do not respond to the impulses, so you can't move your muscles. And you don't want to have that. So what goes in your lips? It's a hyaluronic acid filler, or dermal fillers as they are commonly named. And there are different brands of dermal fillers, and you've probably heard about Juvederm or Restylane, Rivanes, or those kinds of brands. So you know those are the hyaluronic acid and those are the fillers we use in the lips. Okay, so now we are coming to number 2, and that's the question: can everybody use lip fillers? Actually, there are a few reasons why we can't use lip fillers with all patients, and those are, for example, if you've already had permanent lip fillers like silicone oil or bioalchemy, we can't do the procedure. So this is really a no-no. We never do procedures if you have permanent fillers from the past. Also, we have age frontiers. We do not treat minors. So if you are under the age of 18, and maybe even in the USA you need to be 21, I don't know the regulatories exactly. If you want to know for sure, you may call your own doctor or your clinic and they will tell you all about that. So in Europe, and particularly in the Netherlands, we have the age of 18, under which we do not do any cosmetic medical procedures. Now, as for the upper age, I don't really use any real frontier for your upper age, but it is very important for me if someone wants to have fillers, if someone wants to have an aesthetic medical procedure, it is very important that you are healthy, that you don't have any allergies, that your overall medical health condition is satisfactory, you're healthy, and then we can do the procedure. Also very important, we do not do aesthetic medical procedures if you are pregnant or if you are breastfeeding. I have a special video made only on the topic of when lip fillers are not indicated. And if you are interested in it, please click the link below and then you can watch that one too. Number 3, how much lip filler do you need? So this is a topic I usually have some kind of discussion with my patients, particularly the younger ones, but this is how we do it. So it really depends on what you're trying to achieve. So what is your desired volume? What is your desired effect? And also actually what is your age, because with aging you get volume loss, and also you even have volume loss in your lips. So before we can proceed to enhancement of the lip volume, we need to adjust the volume that has been lost prior to going on enhancing, prior on augmentation. A lot of my younger patients come with photos from celebrities, photos from Instagram with all those juicy lips, and very often you guys want to have the same lips as the ones you see on photos. Now it is very important for you to know that a lot of those lips are also full in makeup. There has been done something Photoshop or whatever to make them bigger. So please understand that it is not a realistic photograph what you are seeing. But on the other hand, sometimes some of you want an effect that really does not suit your face. And it is my duty and my calling to make you guys as beautiful as you can be and as natural as you can be. And if I'm saying natural, I do not mean that you cannot do a little bit of exaggeration, because sometimes that can be very pretty, but we do not want to have you watch. I always tend to get to some kind of agreement between your desires and what is medically responsible, and then we always come to some kind of agreement. Now, it is also important whether you want only to correct, for example, your upper lip, maybe it's disproportionately smaller than your underlip and you want it to have the same size, or you want the golden ratio, or you want it just a little bit more. Then we see how much you need. So it's also very important to know that a half a milliliter of any brand of filler is usually just not enough. If you have bigger lips, you will need significantly more than if your lips are a little bit smaller, like mine. I have small lips, so I don't need that much. But be aware that if you're with a friend and she needs a 1 or 1.5 milliliter, it does not mean that you need the same amount. So you might need more. Usually we do not do more than 1, sometimes really not that often, maybe 1.5 or 2, but in the first session, especially if it's your first time, meeting a cosmetic doctor, having a consultation, we tend to be careful. So on average we do like 1 milliliter at a time. So usually you need 1 milliliter and you will be more than satisfied, and sometimes you need more, so sometimes you need 2 or maybe 3 in a few sessions, but usually not more than that. If you count on 1 milliliter, you will always be okay. Number 4. How long does the effect last? This one really depends on the brand of filler that the doctor is using. There are really differences in brands, differences in thickness of the filler, and some brands make special fillers designed for the lips. A bit is also in correlation with how much filler is used. The most of the fillers you can expect an effect about 6 months. Maybe the first time between 4 and 6 months. And there are a few other brands which claim they can give you beautiful effect lasting for 1 year. I would not really consider the full year, because you don't just wake up after 12 months and last night at the party you had big lips and the next day everything is gone. And you understand my point. The first time you do the procedure, if you count on like 6 months, between 6 and 9 months, you're good to go. And probably if you have done it a few times, a few years after the first time, probably you will have 1 year lasting effect. So number 5, if you have used your filler for a couple of years, what happens? If you have done the procedure for a couple of years, a lot of you guys ask me, what will happen if I just quit? If after a few years I decide I don't want to do it anymore, or I don't have the money to do it anymore, or for whatever reason you just stop doing injectables, what will happen? A lot of you guys are concerned, will my lips hang? Will I have any kind of deformation? Well, rest assured, you don't have to worry. If you guys have a responsible use of the cosmetic medical healthcare, and you just come once in a while to have your lips, have them a bit augmented, a bit plumpy, but not too much, don't worry, you won't have any sagging or any dropping of elasticity of your skin. So you can compare it with, if you have like 300 kilos and then you lose all your weight in a couple of months, then yeah, you can have some sagging skin. But if you just eat a little bit more cake during the holidays and then you hit the gym from January 1st and you lose a few pounds, don't worry, you will have your nice lips back whenever you stop. Number 6, does it hurt? Oh, I would be lying if I would be telling you it doesn't. But it does. It does hurt, but there is a very different level of pain we all have. So sometimes your pain levels are high and sometimes some people have a very low thresholds of pain. That depends on how you experience the pain during the procedure. But don't be alarmed. We have ways to soften the pain. In most of the lip fillers, in the syringe itself, there is an analgesic, which within the first few stinges, the analgesic will start to numb your lips, so further on you don't feel anything. So that's a very good strategy. Also, what I like to use is a cream which numbs the area of your lips, and if you have enough time, for example like a half an hour or 45 minutes, then it stays. It can numb your lips significantly, and again you feel less or you don't feel any pain at all. And there's also a third method which we call the dentist block. Well, it's not really a dentist block, but in the cosmetic medical healthcare system we call it the dentist block. We block the nerves with an injection of a numbing agent, so then after a few minutes you don't feel anything at all and the procedure can just go on completely painless. So don't worry, there are a lot of things we can help you with so you don't feel pain during the procedures. And last but not least, number 7. What happens post-procedure? We get a lot of questions, we get a lot of phone calls from you guys where you ask, oh my god, my lips are swollen, is this normal? Yes, it is. Remember you guys, when we use the needle, you always get a bit of swelling. Also, when we use the filler with the anesthesia inside or we do the block, even that causes your lips to swell a little bit. And in the evening and the next day when you wake up, you might experience a lot of swelling. When you look in the mirror, you're like, ah! Don't worry, everything is normal. The first few days you will experience a bit more swelling. Within like 2 weeks, everything will get to normal, and after 2 weeks you can see the effect you will get to enjoy for the rest of the duration of the filler. Also, what we have a lot of you asking is about the bruises. Are the bruises normal? Yes, you guys, bruises are absolutely normal. So some of my colleagues use cannulas, I personally use needles, but either way, bruises after a treatment are normal. We always try to cause as little bruise as possible, but we cannot see exactly where your blood vessels are. Usually we hit 1 or 2 and then yeah, you can have bruises. Bruises in your lips are usually quite small, but sometimes we can hit a bigger vessel and then you can really have a severe bruising. What can you do about it? Well, usually your doctor sees the bruise immediately, then we can pinch it, and after a few minutes everything is okay. But sometimes, you know, the really big bruises happen and then you can expect a bit of your skin nearby to be bruised as well. You know, this is normal. Put a little makeup on that and wait for like a week, maybe 10 days, and then everything is going to be okay. And the last thing which I really have to emphasize, because this one is really important, sometimes it can happen that you get an infection. This is why we always give advice: never put any makeup or lipstick or lip gloss or whatever on your lips like 2 or 3 hours post-treatment. So always be careful about your hygiene in those few hours. If it happens that you get an infection, you should call your doctor as soon as possible. You will probably feel a bump which is painful, which is getting bigger, maybe red, maybe discoloration, and it doesn't get better in the first few days, then you should for sure contact your doctor, go for a follow-up, and they will probably give you some antibiotics or some other medication which will improve the condition within a week or 2 weeks. Okay, that's it for today, guys. Thank you for watching my videos. Thank you for staying tuned to my channel. If you like this video, please give it a thumbs up and be sure to subscribe, because if you do, you will be helping a big community of people to have a responsible usage of cosmetic medicine. Thank you guys, and see you in my next videos. Bye!